Good morning and welcome to the new edition of Frontiers of Knowledge. We as human beings have always been saying health is wealth, and that's true as well. Especially if we look at our dental aspect. A visit to a dentist is not only painful physically, but I think here, at least in North America, the dental work can be the most expensive one, especially since it's not funded by the government and you need a separate insurance. But however, they say that every tunnel, however deep and dark it may be, always has a light at the end of the tunnel. A new discovery has been made, and the people who are taking a medication for Alzheimer can also utilize the same medication to repair cavities and regrow their teeth. This drug, which is called Tideglasip, was developed to help Alzheimer patients cope with day-to-day life. This drug especially stimulates stem cells, and when an experiment was made, it was found that this can repair the stem cells in the pulp of the teeth, promoting new dentine production, and natural teeth can be repaired. So it's a goodbye to the fillings, goodbye to the drilling, goodbye to the root canals. And soon dental filling may be on the dung heap of history. This drug, when placed in the pulp, is a source of the new dentine, and the dentine is a mineralized substance beneath the tooth enamel that gets eaten when the tooth are decaying. But the regenerative dentine without resistance was dreamt of. When the dentine and the pulp are exposed through infection or trauma, then this drug placed in that cavity can regenerate the whole tooth. The only thing is that this medication has to be surrounded by collagen, which you can get from algae, and then placed there slow and steadily. Collagen would immerse and become a part of the body or would degrade, and this medication, Tideglasip, would become the part of the tooth. As a matter of fact, the researchers have said that it is extremely amazing how the sponge of this medication and collagen grows, and not only grows outside, but enables the tooth to become natural. And within 6 weeks, the collagen structure melts away, leaving an intact tooth. When does it become available? Well, that depends on the medical profession, whether they'll like that to come or not. It's an ideal dental product for natural treatment of larger cavities by providing both pulp protection and restoring dentine. So at least one aspect of the dental hygiene would be taken care of. The children might say later on, look here, I don't need to brush my teeth. If it decays, I'll take Tideglasip, place in the tooth, and 6 weeks I'll have a new tooth. But there's one problem. This tooth will be very strong. However, there'll be a certain change and the shape may not be the same. So, one at the younger age, one might need braces. Of course, this new discovery is a godsend to the people suffering from cavities who would be saved the visits, the painful extraction, and the drilling of the dentist. But the medical sciences are not only confined to the dental one. Today, the biggest disease, which is called the silent killer and often is responsible for impairment of functions of the human body, is diabetes. And for years now, as long as one can remember, we have been talking of diabetes of two types, type 1 and type 2. And now, according to Lancet, the most reputed medical journal, it says that there are not two types of diabetes, there are 5 types of diabetes. And the statement says that for almost 100 years, the doctors and the researchers have not updated information on diabetes. As a matter of fact, very few attempts have been made to explore heterogeneity of type 2 diabetes, which is the most pervasive one. Another problem is that diabetes diagnosis is based only on one measurement, how your body metabolizes insulin, when in reality the disease is much more complex and it changes and varies the symptoms, the effects from one to one. Currently, diabetes is classified mainly on the basis of diagnosis. Younger people often have type 1, and well, people when they grow up, they have diabetes too. And it's a presence of the antibodies that attack beta cells, which identifies type 1 or type 2. People with diabetes part 1 have these antibodies, but they cannot make insulin on their own. But the people suffering from type 2 diabetes do not have these antibodies at all. So their bodies make insulin, but they don't use it the proper way, the right way. Based on this criteria, 75 and 85, between 75 and 85% people are diagnosed as type 2 diabetes only because they have insulin which is not being used properly. Now, as a matter of fact, that is not the reality. So now 5 types are there. First is SIRD, severe insulin resistant diabetes. It involves the highest level of insulin resistance and the highest risk of kidney disease. Then it's severe insufficient deficient diabetes. It's confined mostly to the younger adults, especially having poor metabolic control. And then, severe autoimmune diabetes is for people who are currently having type 1 diabetes. There are 2 more clusters, mid-age related diabetes, MARD, M-A-R-D, and mid-obesity related diabetes, MOD. They are more benign forms of diabetes. And more often than not, these 2 diabetes, mid-age related diabetes and mild obesity related diabetes, are usually confused by the doctors even with type 2 diabetes, while in reality it is not. So this SID and SIRID, severe insulin resistance and severe insulin deficient diabetes are the most severe forms of diabetes, and they were also included in type 2 diabetes, which is wrong. So the researchers say that newly diagnosed patients who have had diabetes 2 for a long time should be re-examined by the doctors to identify whether they are suffering from SIRD or SIDD, whether it's insulin deficiency or whether it is insulin resistance. This new classification would enable the doctors also to treat those diabetes which is not very harmful and for which medication need not be given. Anyway, this new classification is going to have a major impact on the diagnosis and treatment of diabetes. And now we were talking of the dental hygiene. But we have bones in our bodies and they break. Fractures, breaking of the bones is a common phenomenon, but it's painful one. And when a bone breaks, earlier they used to just have a cast. Now medical devices like screws and pins are often used to hold the pieces together while the bone heals. But this process is quite painful, long, and difficult. And now they have come with a ceramic implant. It's a 3D printed ceramic implant that holds the fractured bones together and slowly itself becomes the part of the bone. And that's amazing because the ceramic implant, while holding the bone, transmutes itself into a part of the structure. And this is created by the University of Sydney in Australia. They tested it in rabbits and sheep. And then, they saw that even the larger limbs of the sheep, for example, the large leg fracture, all the animals in the research had 100% success. And this happened much quicker than adults do. As a matter of fact, they say that the sheep, after their legs had been broken and then the implant placed, could immediately walk after the surgery where the implants were placed. There was no downtime at all. And after 4 weeks of the surgery, they walked with stabilized manner without any problem. However, 4 weeks were required so that the strength of the bone is recouped. 3 months post-operation, researchers observed absolutely clean healing in 80%, and in others it went up to 6 weeks. After 6 weeks, the bones were again x-rayed, and it was found that they were natural bones. Nothing was there which seemed to have been implanted, and if implant was there, it had dissolved in the body itself. The implant has a similar composition to the natural bone, so it can degrade itself into body without any toxic side effect and become a part of the bone, because the body cannot tell the difference. Normally, implants suffer from that problem. Secondly, the human body's immune system many times rejects the bone grafts. But here in a ceramic implant, that is not going to happen. The implant is made from calcium silicate, and it's a mineral granite that has amounts of zinc and strontium. And those are the elements basically in the natural bone. One downside is that in the beginning, in the first 4 weeks, it would have a lot of rigidity, but there'll be no pain. And slowly, in case massage or some other techniques are done, the rigidity will become less and less. So these are the three new advances in medical sector. Two, dealing with the bone structure, one confined to the teeth, and maybe the same collagen can be used for the bones later on. But this ceramic implant is a great success, and so is the new classification of diabetes. How do you like that? I'm sure that you would like to marvel at these scientists who make our lives healthier and easier to live with. We can face the calamities, the disease, fractures, and even cavities. So maybe sweet tooth is not too bad after all. Have a nice day. Thank you.